Hi, my name is Maddy McCarthy. I'm an assistant clinical research coordinator here at the Stanford School of Medicine, and I work particularly with the Stanford Pelvic Health Center. Today, I'm excited to be presenting our poster, which looked at the immune cell composition of the gut muscularis layer and saw how that correlated with aging and fecal incontinence. So we got the idea for this study knowing that inflammation has been speculated as an etiology for declining gut function and also pathologies of the gut. But we knew that little was known about the immune composition of the muscularis layer in the human intestine. And we wanted to study the relationship between this immune cell composition and aging and also fecal incontinence to see if there was any relationship. So to do this, we obtained colon tissue under an IRB approved study, and we got this tissue from patients that were undergoing surgery for several indications. So from this tissue, we dissected the muscularis and analyzed it using flow cytometry to identify total leukocytes, macrophages, lymphocytes, and dendritic cells. And then we also measured FI using the Cleveland Clinic fecal incontinence score. And then to do our analysis, we used a Pearson correlation. So we were able to obtain tissue from 26 patients. 21 of them were female, making 80.8%, and our age ranged from 25 to 95 years of age. So 14 out of 26 of these patients had completed the Cleveland Clinic fecal incontinence score post-operatively. And we found when studying aged with the immune cell composition that there was age was associated with rising macrophages, but declining lymphocytes. And we measured this as a percent of CD45 plus cells. And as you can see in the figure A, we also looked at incontinence scores and found that higher incontinence scores were significantly correlated with increasing macrophages and declining lymphocytes. So similar, and then figure B. And then as age increased, the percent of live leukocyte levels also increased when we did a count of the leukocytes. And the level of DCs in all with age or incontinence score, there was no correlation. So our findings suggest a shift in immune composition that favors muscularis macrophages might contribute to age-dependent underlying GI disease pathogenesis, but that being said, future studies are certainly necessary to determine whether immunotherapies may be effective treatments for these disorders and further investigation into their etiology.